you got an order to put in an IV, you get your fluids. The one that's on the order, this one is just normal saline. And you grab your tubing. You're gonna wash your hands before you do any of this. That way you're not possibly introducing any germies. So you connected this in here, making sure that you're keeping both the spike sterile and also the port that it's going into. And then you'll take this and you'll like squeeze it, filling it halfway. You're going to attach your extension tubing to the IV tubing. You're going to take the caps off, making sure to keep them sterile and not touching them with anything. And then you're going to prime your tubing. Until it drips. Turn it back off. Keep it to where you can reach it.
Nice, thanks.
And then you're going to start the IV. I'm going to check to see, find a good vein.
You forgot to pull it off. That was like the only thing.
Making sure it's a quick release, and then find the vein that you're going to use, and then I'm going to let it go. And then getting everything ready, your tape already cut off, making sure you have your needle and your catheter and your tegader. So I've already performed hand hygiene, and now I'm going to put my gloves on.
That was mine.
And placing your tourniquet with quick release, making sure it's tight enough. You're not going to want to limit the amount of time that's on there.
Like I kept 2 extra. You probably have a bunch of extra still.
No, you're going to before all of this. It's been too long, so I'm going to release it. Let it go and perfuse, and then put it back. Use whatever your facility prefers. This one's just an alcohol swab. And you're going to let it dry. Don't fan it. It'll introduce bacteria. Once it's dry, you're going to start inserting the catheter with put the bevel up.
Is that one? There's one on the back side too.
You're gonna go at a low angle.
Behind it. Yeah. Is that one up there? Yeah, there we go. That one's waiting to
Oh,
get
and then if
taken
you'll
from
pop,
physical
you
plans.
can stop pushing in the needle and just advance the catheter. You're looking for a flash of blood as well to make sure that you're in the right area.
We don't want to hurt ourselves.
And then this would go in the sharps. You're going to hold this in place. I'm going to remove my tourniquet.
We want to grab a new one and change it on the units. Okay. I mean, obviously, we're not going to do that while we're in there unless you do it with your instructor like I did. I grabbed somebody and did it this week.
You can have like gauze in case blood starts going.
People try to weasel their way in, but then you can end up hurting yourself. Okay.
Holding it in place. And then I'm going to open this, that way I can kind of feel for the flow, making sure it's flowing correctly. And then
So, orders? Ben. Ben.
So you hold that, so you hold it up here, and then I kind of switch my hand, like, cause I hold it, and then I put it in, and then I kind of go around, and, cause I, it's really with my right hand. I flipped it in, and that's when I let go, so I look at the other, okay, and once it's in, I kind of, okay. Let me get some water, and then I think I need, I'm gonna go to the bathroom. I'm gonna redo my video, see if I get a better one. I just feel like I'm gonna fail that one, so.
and then going to put on the sticker your initials, the date and the gauge, and place that over the tegaderm, and then there's blood flow happening in my thing, which is weird. So I'm doing that real quick. You're going to secure it with a piece of tape. And then they're good and for now. And then we have an order from the doctor to put a saline block. So we're going to go into the patient's room, again perform hand hygiene, and put on new gloves. None of this would be here. So you're going to turn the fluids off. And then undo them. You would put a cap on the end of this. On the end of this tubing if you were going to reuse it again later. And then for this one, since this is open, it would be new, and so I'm gonna clean it. But you get a new one of these, the salines. You would push all the air out of it, and then you're going to connect it to the end because they would both be sterile. Push in your 5 to 10 depending on your facility's guidelines. Remove this, and then you would place a sterile cap over. Just like that. And then you're going to clamp this off to make sure that the end doesn't claw off. And then you have DC orders. You're going to remove the IV line. So we get all of our things ready, get an alcohol pad or a Unisolve. And then I'm just going to start removing this. If it was a elderly individual or child, but anybody with fragile skin, you're going to want to be extremely careful with taking it off, using again the alcohol or the Unisolve to help remove the adhesive. And then once you start doing this, you're going to want to hold the catheter in place. That way you're not just ripping it off.
Hi, I'm Caitlin, and I'm going to be doing an IV today. I have orders for the IV. I've checked the medication for the patient. The patient's the right one. I've made sure that the tub and the spike is not contaminated.
Holding that in
I've
place.
checked my flow rate, which is
You take some 2x2
or over
pause.
time or minutes multiplied by drops per minute. That's wrong, right? Drop factor, yeah.
Place
Flow
it
rate, drop
and
factor, okay. Alright, go ahead.
pull it out. Make sure this is intact.
Hi, I'm
And then
Caitlin. I'm going to be starting an IV today. I have orders
I'm going
from
to
my
tape it in
doctor.
place.
To start this IV, I've cross-checked the patient
For your
with the
fluids,
medication and made
the
sure
rate that they would
medication was
go
right.
would be determined
I
by
added my extension, and I primed my
the
tubing.
medication itself, or
I've
in this
also
case it's just
calculated
normal saline.
the
So
flow rate,
you would,
which is
when you would
milliliters
administer the IV,
over time,
and it would go
minutes multiplied by
at the amount
drop
per
factor.
hour divided
So
by
I'm going to go ahead and find my vein.
60 times the drop factor of the tubing.
Found my vein.
So you'd want to make sure you do all that
Tie my tourniquet.
before you like turn the fluids on.
I also have
Go into
all
the
of my
arm.
supplies ready.
But now it's all removed.
So I'm going